Assalamualaikum and hi. Here is our presentation on depression disorder and cognition. But firstly, I would like to introduce you to my group members, which are Nur Syairah binti Muhammad Suhaimi, Nur Wardah Syairah binti Hashim, Nur Aina Washita binti Kasim, Nur Afsah binti Fazil, and myself, Raja Haifah Patricia binti Raji Zaman. Depression is a type of mood disorder where it can cause a constant feeling of sadness and loss of interest in the things they used to love, causing their life to fall apart. It is considered as a serious medical illness as it is the second leading cause of death in 15 to 29 years old. WHO stated that about 200 million people suffer with depression and close to 800,000 people die to suicide every year. The purpose is to research the relationship between depression and our cognition by doing a research on this topic, as well as using our critical thinking to have better understanding. And lastly, as depression is a type of mental disorder, hence we believe there is a connection with our cognition.
The title of our study was Depression Disorder and Cognition. What is cognition? Cognition is a term referring to the mental processes involved in gaining knowledge and comprehension. In addition, depression disorder is a disorder of a person's mood that interfere with a person's daily activity. It is important for us to know about the symptoms of depression. Symptoms of depression can be seen mentally or physically. This study aimed to delve into how these depression disorders are closely related and affect cognition. We found this topic interesting to study because we were able to add more in-depth knowledge about depression. In this study, we will interpret and discuss the disease of depression through articles and experiments related to this topic.
What are the causes of depression? Depression is more than negative emotions. Depression may trigger a variety of symptoms, some of which affect our mood and others which affect our body. People who are depressed often have irritable, aggressive, restless mood and they will feel empty and quickly give up. The symptoms include headaches and a lack of appetite which lead to rapid weight loss. Involvement of part of the brain when experiencing depression disorder. When we have depression disorder, there are some part of our brain that are involved. So, what is that part of the brain? Firstly, the brain is divided into three parts: the prefrontal cortex, limbic brain, and reptilian complex. In the brain, these three parts play their respective role. The prefrontal neocortex involved in high-level cognitive function as well as emotion regulations. The limbic brain is involved in emotion that regulate the species self-preservation and reproduction, while the reptilian complex is involved in both motor reflex and social context. In addition, a decrease in metabolism in the prefrontal cortex, especially the dorsolateral and dorsoventral brain regions, may cause the depression disorder. Besides that, the amygdala and dorsomedial thalamus are all major limbic subcortical brain regions implicated in depression. Furthermore, when we are stressed, depression will set in. This is because the hippocampus releases the hormone cortisol when we are stressed. When our brain is flooded with cortisol for an extended period of time, the development of new neurons in the hippocampus may be slow or stop. This will cause a decrease in the actual size of the hippocampus and cause memory problems. In addition, the amygdala, which is one of the structures of our brain, will enlarge if we are in a state of depression. This amygdala is also associated with emotional response. Sleep disruption, change in activity levels, and other hormonal change will arise as the amygdala grows large and more involved. People who suffer from depression, according to report, have more inflammation in their brain. This brain inflammation can exacerbate depression to the point of mood disruption as well as have a detrimental effect on learning and memory. The treatment for depression. The treatment for this depression is continually developing and the mix can vary depending on a number of factors. The treatment refers to how long we had it and how serious everything we're dealing with is. Medication are widely used to treat both physical and mental. So depression may be treated with therapy. The first therapy is cognitive behavioral therapy, CBT. This therapy has been shown to be extremely successful in treating depression. The next is psychotherapy. Psychotherapy is a skill-based active therapy that assists people in the development and maintenance of capacity to cope with stressful thoughts and feelings. There are other therapy can use methods like transcranial magnetic stimulation (TMS) and electroconvulsive therapy (EST). This therapy could be helpful and suitable for some people. Finally, adopting healthy habits is an integral aspect of overcoming depression. This means that anyone suffering from depression must maintain a balanced diet, daily exercise, and restful sleep schedule.
There are many effects of depression on cognitive development. Among the effects is not being able to make any decision. Those with depression cannot make any decision due to its unstable emotion and their those that are ranged. To make a decision, of course, we need a sane mind, calm, and in the state of readiness to think. Yet, in a state of sadness or depression, we certainly cannot make a decision, can't think well. Because of that, those who suffer from this depression cannot think which is good or bad. The next effect is the memory duration will be very short and unable to focus. A large number of patients facing stress will usually smoke and drink alcohol excessively. It will definitely affect memory. Another effect is the information processing skill will be impaired. Forgetting is when a person begins to forget, lose, and find it difficult to remember all the information. In the process of encoding, for someone who is depressed, it's also already difficult to run well and quite difficult let alone to recall it. For those who suffer from depression, he cannot pay full attention to stressful situations.
In this experiment, there was a depression patient named Steven who received treatment for depression through ketamine. It is common knowledge that ketamine was previously used as an anesthesia medicine in the 1960s, but now it is used to treat depression patients. This treatment is given to an IV in the arm. According to Steven, after receiving treatment 4 to 5 times, he felt motivated to continue his life because with the treatment he received, he felt that it could help him to cope with these depressions. In addition, this treatment is on effect in the gluten system. This is because ketamine can produce proteins that repair connections, help form new ones, reroute around area of damage. It's a process called synaptic plasticity. The total dose given to a patient is according to their weight. There are many patients who try this ketamine treatment even though there are antidepressants that have been approved by the FDA. This ketamine treatment get results that vary according to the patients. As many as 85% who try this ketamine treatment get better, and in others, it only help a little in their depression problems.
Psychomotor symptoms of depression. According to the findings, psychomotor disturbance is known to occur in many psychiatric disorders. Depressed patients have been shown to have increased speech pause time as compared to a mixed group of non-depressed psychiatric control subjects. It reduced looking and decreased facial expression, and it also increased hand movement. This occur especially in patients that have depressed under 40 years, more likely to have motor retardation. For conclusion of this report of depression, as we know, stress problem has different types and level, and every layer of society, regardless of age, is prone to have stress problem. And if we do not take appropriate action and get good treatment by psychiatrists, this problem or disease might get worse. As we have documented in this report, there are a lot of factors that can be taken into consideration when researching the connection between depression and the brain as well as our cognition. If the person have depressed anxiety, they could not control their emotion, and the depression began setting. This is because the hippocampus releases the hormone cortisol when we are overstressed. However, this disease can be treated if depression persons start take appropriate action for the sake of healthy mind and healthy body. If depression is not prevented in earlier time, it can lead us to negative effect on our cognitive development, and it will worsen the situation that can cause death and or suicide.